Next, let's talk about the wonderful care you're doing for the many people who have mental health conditions. If you think you deserve to be paid for helping people with mental health conditions, you're absolutely right. What you do is bill 14043, and for your patient, you get $100 per patient per calendar year. And these are patients with Axis 1 diagnoses. And again, this isn't for the person who is sad because the Canucks lost again. It's for the people who have Axis 1 diagnoses, DSM-4, not DSM-5, that cause impairment. Remember as well, this does not include Axis 2. So as much as some of the patients with borderline or other personality disorders may need increased care, they do not qualify for this particular fee item. And similar to the complex care planning fee, the mental health planning fee is also 30 minutes face-to-face. Remember, the 30 minutes does not need to be at one time. It can be 10 minutes here and 10 minutes at that visit. But it must be during a visit, and you must bill the visit on the same day. You can bill counseling on the same day, but remember what we said about that counseling. It's got to be 20 minutes of counseling. So a big flag is if someone bills counseling and the mental health fee. That means that you spent 50 minutes with the patient. 20 counseling and 30 mental health planning. So you better have that documented. And you may have done it, but you must have it documented. Otherwise, that'll be a red flag. The idea is it's not a routine annual fee. If someone went through a tough time and now they finished their major depressive episode, they no longer require a plan every year, then you can't bill it. But if they do have ongoing increased risk, then you can do it. For patients who are in facilities, they do not qualify, and certainly if you're not a fee-for-service physician, you do not qualify. I've been planting hints that we should always be specific, except in certain scenarios. When we're doing our diagnostic codes, we always want to be specific except for two main areas. The first was that preventative care. Remember where we didn't want to say 305.1, which is smoking, we wanted to say 786. The mental health ones are the second exception. So we don't, if someone has bipolar, want to put 296.7, even though that's a specific diagnosis. We want to put a 3-digit code, 296, affective psychosis. I know, doesn't sound like it's the right thing, may not fit your patient, but that's what you have to put down. They may have generalized anxiety and you want to put 300.0. But again, when it comes to the mental health, only 3 digits are accepted. So you have to put 300, which is general neurotic condition. Look at the list on this slide. Memorize it, write it down somewhere, put it into a sugar sink or an Evernote, and always refer to it. Whenever you're billing the mental health fee code, it must be one of these diagnostic codes. To bill the mental health fee planning item, you must have one of these, and if it's anything with a 4th digit or a decimal, it will not be accepted. What does it mean to make a plan for mental health? Well, certainly you want to review the chart and the history and the therapies. You want to do things such as a mental status exam. You want to use your validated assessment tools. You want to have a CAPS or a PH9 or a mini mental or a MOCA. You want to make sure that you've confirmed the person still has an Axis 1 diagnosis. And you want to make a care plan with them. Think about all the legs that you want to set up under that person's table. Nutrition, counseling, maybe medication, maybe social integration, maybe volunteering, physical activity, maybe substance avoidance. These are all things you're going to want to discuss. You're going to want to review who are the other healthcare professionals that are involved. Even if the person has a psychiatrist or belongs to a mental health team, they can still bill this as long as you're still the most responsible primary care physician. And of course, as with all of these things, you are going to document everything you talked about, either with a template that gets adjusted every year, or writing down the content of the conversation that you have. Now, earlier, we said that everyone in British Columbia who has medical services plan gets 4 counseling visits And of course, you are very sick of me saying that it must be 20 minutes for a counseling visit, and you must document that. If you have had the mental health planning fee billed for you, for your patient, 14043, that opens up another 4 counseling visits for them. Now, just note that visits 1, 2, 3, and 4 will be the regular ones that end in 20, 10120, 15320, 16120, 17120, 18120. But these other 4 extra ones, visits numbers 5, 6, 7, and 8, those are slightly different. And you can see here 14045, 14046, 47, and 48. As you'll see, you do, for those extra 4 counseling visits, have to put something different. And yes, this is eligible for rural retention, so you do get a little bit more if you're in a rural area.